Hello everyone and welcome to 180 Degrees of Impact. I am Matt Scott and today I have a special guest. Will you introduce yourself?
Thank you, Matt. My name is Eshete Yilma. Currently I'm Special Advisor to HPN Health Office Chief at USAID Ethiopia.
Awesome. So right now obviously we are in Ethiopia and I'm curious to learn more about your work, Eshete, and about why you do your work. You've been doing it for a while, as you mentioned to me. And so first and foremost, could you tell me about what is the work that you do?
I was a health system strengthening team leader at USAID Ethiopia for quite some time. When we say health system strengthening, what we are talking about comprises of six major elements.
Oh, wow.
Financing, which includes insurance, health insurance, governance of health systems, management, the supply system, which includes forecasting of commodities need, procurement of the commodities, and the distribution of those commodities which you have procured, and managing those commodities at the health facility level. The supply system, this is what we call the health commodity supply system. This is one element. And the other piece, which is extremely important to deliver health services, is the human resources. We are very much, USAID is heavily engaged on training of health professionals, mainly frontline health workers, who are the champion at the community level and health center levels, and also medical practitioners. And therefore, I think, and then also there is another element which is extremely important, that is making available and creating a culture of decision making based on information, health information system, which has got different elements also. This is what we do. I was responsible for this thing for quite some time in Ethiopia. We are very much happy with what we have achieved in Ethiopia. It is creating a resilient system, local system.
I'm curious to learn more about that, actually, about what kind of, because I'm not a health expert at all, but I'm curious to learn what are the areas of health that you are addressing, and you also mentioned championing at the community level.
Yeah, then I think, what I mentioned to you is the work I am doing, or the way the activities I'm managing. But it is not what USAID is doing in Ethiopia is not limited to that.
Right.
It includes, as you know, you are familiar with HIV/AIDS program,
Yes.
PEPFAR.
Yeah.
Okay, this is one thing. And you are familiar with also malaria program, PMI we call it, President Malaria Initiative. And Ethiopia is one of the focus country. And then we have got a lot of activity. We have got TV programs. And then we have at the community level also, we do at the health facility level, we do a lot of maternal child health activities to reduce maternal and child deaths in Ethiopia. We are supporting the government initiatives, and we are party to the government programs, and we are the major donor in Ethiopia for that matter in the health sector, I can say. And therefore, when we come to the community level, maybe you are familiar with frontline health workers in Ethiopia, what they call it, health extension workers. These are female cadres. We have got now, when I say we, I'm including the government of Ethiopia also as a key partner who is at the driver's seat. And the health extension workers are the community-based frontline health workers. They are now about 40,000 community-based health workers, mobilizing the community to institute behavioral changes in the community. They are excellent. I think Ethiopia has done excellent work in that area. It's very much known globally what Ethiopia has achieved. They promote, for example, family planning activities. They promote healthy behaviors at the community level, hygiene, latrine construction, immunization, and all these key interventions. We are the key ally to the government in Ethiopia to work on that area, I can say.
I think that's really interesting to hear the behavioral change piece, because like where I work at Second Muse, we do some work, especially in the food and nutrition space, focused on behavioral change, and that's happening in Tonga and Fiji, and then there's also, other work that's focused on behavioral change, and I know that's tough.
Yeah.
And I'm really interested to learn more about that, but I want to know from you, like, why is this work so important to you?
Because, the community engagement, ensuring the communities are engaged and also producing their own health is the most important thing, really. And then, unless if they become passive element, and if it is just top-down activity, it doesn't work that way. The engagement of the community is key, and you have to have a cadre at the community level to mobilize the community to that end. What it means, particularly what makes Ethiopia successful through the health extension program, is that while they are based at the community level, while they are community animators, while they are community promoters, they are also on the payroll of the government. They are salaried, they are paid. And then I think, and all of them, I can say, almost 99% of them are female, young ladies, who knows the health need of the community, the household. And they move in house to house. And then that's how it works. It has worked very well. It is a very good model for Africa, I can say.
Just thinking also back to the work that they actually do to create change, or to create that behavioral change. What is it that they're doing? Because I know that's really difficult to get people to change their behavior. Like, it's one thing to tell them what to do, but it's another to actually have them do the work.
They have got a lot of communication tools. They have got tools how to communicate the community. But the good thing is that they are posted at the health facility, which is not a proper health facility, the one which it is not clinic or something, but a small small rooms, house or made constructed by the community, and that's what you call health post. They are posted there, and then they are not staying the whole week there. They have got schedule where they go to house, and they have got a schedule also for the community conversation. They engage the community, and they are supported also with animators at the community who support them, a group of female mothers who support them also to be engaged. They have different models to reach the community, to mobilize the community. It is really a fantastic way of doing business.
But what are some of the challenges of that work? I mean, you mentioned like the more limited facilities, but what are some of those biggest challenges that you've encountered in your time doing the work? When we, for example, when you look at me, when you ask me this question, you think that I'm a medical doctor. I am not a medical doctor. I am a system person. I'm economist by my background. Then, in that context, what you have to understand is always when you talk about health delivery, people think of getting some kind of medicine. These cadres, these female health workers are focusing on behavioral change. Therefore, they don't distribute or give or make injections at the community level. And that's what the householders, individuals expect from them. They are limited training, and they do only limited provision of drugs to the injection to the community. Otherwise, they don't. This was a challenge. Why are you not curing my son? Why are you not giving me this? This was a challenge. You see, because their activity is very much dominated, and it's a primary health care, behavioral change, basic services, creating awareness, mobilizing them, referring them to the health centers, referring them, and in promoting healthy early health seeking behavior at the community level, and to go from house to house and see who is sick, and they refer them to the health center. This is what they do, and that's how it is structured. Yeah, thinking about that, because that sounds really difficult, that people often are expecting one thing, like these I would say more immediate health outcomes rather than like something that's going to have a longer impact. And I'm really interested in knowing what is the impact that not just you, but those that you've worked with in the community have had.
If you see, I think I will encourage you to see some success stories, documented out there.
Right.
Mothers speaking what they benefit from this, because it's not so easy for them at the beginning to understand. But through time, when they found us, because for example, breastfeeding is the most powerful thing in the community, and then the healthy, hygienic life, latrines construction, how that has improved, how that has reduced the morbidity at the house level. They have seen them, the changes. Their sanitation level has improved significantly. They can see and they tell you the story. And then they have realized it now, currently, particularly after 7-8 years, they have seen the impact, the changes, and they got it. They got it, and that's how it works.
So one thing I really want to know now, just as a communications and marketing and storytelling person, is how are you documenting or communicating those stories, or how do you get those stories from those mothers?
We have got a lot of through our implementing partners. We have got success story documented in many various modalities, in different modalities. They are out there posted. It's a public document. You can see that. Yeah.
And then also, just as a follow-up to that, talking about the impact, what is the impact that you ultimately want to see?
So what? That's the question you are asking. So what?
Yeah.
Why are we doing all this investment? Yeah. It is because we want to reduce maternal deaths in the country, and child deaths infant deaths in the country, reduce morbidity, control diseases, the outbreak of diseases, and that's what we're doing. We have seen significant change. I refer you to go and see what Ethiopia has achieved, to which USAID is party. DHS, Demographic Health Survey, is golden standard, which documents the changes, the impact of all these interventions in the country. There is significant improvement in the reduction of deaths in Ethiopia in the health sector, I can say, and the disease is very much under control. You can see a lot of improvement in that area.
I don't know. I'm really interested because there's a lot that I have to learn more about, and I'll learn more about that today a little bit. But I think one thing I want to know from your perspective is looking at, especially if you're speaking to people who are doing similar work, from your perspective, what piece of advice do you have for them?
Yeah, one thing, the good thing is that I think priority setting and influencing policies in resource allocation and picking the key intervention with high impact is the most important thing. And then I think also when we talk about USAID is a champion of working at the community. We have got that comparative advantage of being flexible to work at the community level. We have to build on that, while at the same time also focusing on the system thinking, systems, the elements I mentioned to you, financing, domestic resource mobilization, health insurance, creating resilient system is the focus we have to consider as a key, so that countries like Ethiopia should not always depend on foreign aid.
Oh, absolutely.
Foreign aid. The only way you can do that is when you engage in domestic resource mobilization and also build systems that is resilience. That is what my piece of advice for the health officers.
Ultimately, just thinking about your work as we get to the end of the interview, and my final question, or one of my final questions for you, I guess, thinking about your career and all that you've done, if it were all documented as a book or documentary, I'm curious, what would the title potentially be, and why would that be the title?
Yeah, well, as you know, this is a very short interview, and then I think we have done fantastic work in Ethiopia, I can say. We have made the best out of the taxpayers' money, and we have got successful programs in Ethiopia, I can say. But of all the work on which I'm engaged, the one which is very much dear to my heart is the healthcare financing reform, which is the core of which is domestic resource mobilization at the lower level, at the health center level, at the hospital level, that ensures the availability operational budget at the facility, so that they are able to make decision on those on the resource they generated at the facility level, and to procure supplies, essential drugs at that level, so that there will be a quality of services. This is a supply side, improving the quality of services at the health center and at the hospital level. On the other hand, this is a supply side piece, but on the other hand, the community piece is also very interesting, which is mobilizing the community to enroll on community-based health insurance. This is to reduce out-of-pocket expenditure of householders, which is very high in many African countries. This is protection mechanism. This is including the poor to have access to medical services. And we have done excellent work in this area, being partner to the government. I think we have reached something like 16 million Ethiopian people through that initiative. Therefore, I think this is activity which is very much dear to my heart. I can say that a champion of health financing reform in Ethiopia is a title I prefer. How's that?
I love that title. That's a great title. I was going to ask, like, so what's the title? Where could I find it? But hopefully you actually write that book. That would be really exciting. And just it's thinking of final thoughts. I'm going to adjust this a little bit more as we wrap up. But just thinking of final thoughts. Like, do you have any other final words or anything that you would want to share as part of this interview?
Yeah, you know, working with USAID, the USAID is in terms of staffing, based in two types of employment: foreign service and the local staff. This is the combination, and then it implies a lot of intercultural work.
Right.
That is the beauty of it, and there is also challenge there. And then how that works is a question of intercultural competency, we call it.
Yeah.
That works that's very important element. And then in so doing also, I am a local staff, a senior local staff, working with the foreign service. The foreign services come here and stay here for 2 years or 3 years. Okay?
Yeah.
And then, but development is not a 2 year or 3 year or 4 years.
Right.
Right. It needs more longer time. That's where you can see the importance of local staff. They are institutional memory. They keep the continuity. They ensure the continuity of the program, and that is very important thing, arrangement for us to understand. And the local staffs bring very important contribution to the whole program of USAID is doing.
And that's why I'm very thankful for you. I'm sure that USAID is very thankful for you and for all the other people who are doing the work throughout Ethiopia and beyond. But I'm curious, just to wrap it up, is there anywhere you think any resources people should look at to learn more about your work?
Yes, we have got, I think, the website, USAID has got a website. It is a public document. You can see a lot of good work, not only limited to Ethiopia, but across the world. We have got a website, USAID has got a website. You can explore that. I encourage people to look and see the good things we are doing in many countries. Yeah, I can say that.
Thank you, and if people want to learn more about 180 Degrees of Impact, I encourage them to check out. The website is www.lets.care, and yeah, I appreciate it. Thank you so much for this time. But as one thing I say as I wrap up all of the interviews is keep impacting. It's a little bit corny, but that's how I say it at the end. Keep impacting, and keep